My name is Carmen Vargas. This presentation is assignment number 2. In this presentation, I will give a brief introduction. I will talk about health determinants, 3 types of strategies used to improve the health of Australian Indigenous children and youth, and with all this information, I'm going to give my answer to the main question for this assignment. First, I want to mention that when referring to Aboriginal and Torres Strait Islander people as one group, they will be referred to as Indigenous people. Just to give some background of Indigenous people, they are the descendant of people who occupied Australia more than 50,000 years ago. They have experienced great trauma and great disruption in their cultural well-being that have prevailed for many generations. For example, the impact of infection and chronic diseases, social dislocation, family breakdown, and privation in the connection to the land, that nowadays it is known to have a great deal in the health outcome of the indigenous. Aboriginal and Torres Strait Islander people in Australia represent around 3% of the total population. It is considered a young group compared with the non-Aboriginal Australians. They are more likely to live in urban and regional areas than remote areas. In the map, we can see how the distribution of indigenous population are heavily grouped near the major cities. By definition, determinants of health is something that can influence health in a positive or negative way. Includes social and environmental factors and health behaviors. In this figure, we can see how social determinants extend inwards to affect other factors, including health behaviors in biomedical factors that are part of a person's lifestyle and genetic makeup. According to the WHO, the social conditions in which people are born, live, and work are the most important determinants of good health or illness. In the analysis made in 2014 for the Australian Institute of Health and Welfare, says that between 1/3 and 1/2 of the health gaps between Indigenous and non-Indigenous Australians are associated with differences in socioeconomic position. Many Indigenous people live today with poor health, associated with poverty, malnutrition, overcrowding, poor hygiene, and environmental contamination, and prevalent infections. Also, an inadequate clinical care and health promotion, and poor disease prevention services. Indigenous people are one of the most vulnerable groups in Australia. Health inequalities are complex and are deeply related with the socioeconomic determinants of health. These conditions can influence whether people adopt healthy behaviors or not. The Victorian Health Promotion Foundation considers 2 key inequities that affect the most to Indigenous people. The first is discrimination because of the ethnicity or race that causes great mental distress. The second one is the connection with land that is an essential part of the Aboriginal view of health, with personal identity considered inseparable from the place. The difference in almost all measures of health and well-being between Indigenous and non-Indigenous Australians have become known as the gap. All governments in Australia committed to work towards closing the gap. It is described as an holistic approach that is closely associated with social and behavioral determinants of health and the performance of health systems as well. The targets of halve the gap in child mortality and close the life expectancy gap go directly to health outcomes, while others address social determinants of health, such as education and employment. It recognizes that if health and welfare interventions are made in an early lifetime, such as childhood, the outcomes for that person later in life will be better. When we talk about holistic approach, it considers the Indigenous conception of health as a holistic understanding of well-being, where the social, emotional, and cultural well-being of the whole community affects a person's health. The critical importance of land to Indigenous well-being, it is not just a specific well-being factor. Land seems to be a powerful factor that influences the well-being. Now, I will mention 3 of the multiple strategies designed to improve health of Australian Indigenous children and youth. Poor nutrition through the lifespan contributes to illness. This begins with maternal and child health. involving problems such as low or high birth weights and malnutrition. There are reports that highlight nutrition issues and the association with disease and therefore morbidity and mortality in indigenous people. The National Public Health Nutrition Strategy contains two complementary national public health nutrition strategies. One focusing on the whole of population and another on indigenous Australians. The main objective is to improve indigenous health and well-being through a better nutrition. The priority areas for action cover a wide range of issues and have been grouped into 7 key areas. These action areas involve issues and factors that can influence food choices and nutrition in indigenous people, not mattering where they live. The National Aboriginal Torres Strait Islander Nutrition Strategy and Action Plan 2000-2010 provided a broad framework for nutritional intervention, addressing both supply and demand issues. However, implementation of the strategy was neither sustainable nor well-resourced and was fractured and opportunistic. The main achievements of this strategy are related with the food supply, training on indigenous and health promotion workers, and the advocacy for improving indigenous nutritional status. The diversity in culture, language, geographic, and socioeconomic influences in indigenous people represent great challenge when addressing sexual transmissible infections and blood-borne viruses. The National Aboriginal and Torres Strait Islanders Sexual Health and Blood-borne Virus Strategy builds upon the work of a previous sexual health strategy. This strategy has 5 objectives that were designed to achieve the main goal. These objectives have a strong approach in the prevention and treatment needs, and also in sexual health education and awareness. Within this strategy, 4 action areas were considered as high priority. Also, the target populations are the ones in more risk to getting these diseases or have important barriers of access or language. It is important to mention that some programs included in this strategy have been continuously applied since 1997, and these strategy results were part of the framework for the 4th National Aboriginal and Torres Strait Islander Blood-borne Viruses and Sexually Transmittable Infection Strategy 2014-2007. The difference on the life expectancy between indigenous and non-indigenous Australia is a priority concern. The rate of mortality is for some regions due to infant mortality, and the reduction of this helps to narrow the gap on life expectancy. The reduction in child mortality since 1970s is linked to the improvement in the access to primary care services in remote areas, both through government and community control services. In 2001, the New South Wales Aboriginal Maternal and Infant Health Strategy began. The main goal was to improve the health of Aboriginal women during pregnancy and decreasing perinatal morbidity and mortality. The strategy included 3 main action areas. There are many factors that contribute to the success of a strategy, and in this case, the training and support program and the collaboration between programs were the key elements for the community development and strategy sustainability. Many Aboriginal women now have services that they can attend that are culturally appropriate and valued by the community. The attention staff in general highly skilled and committed and equally determined to improve outcomes for Aboriginal women and babies. The main question to answer is why do Aboriginal and Torres Strait Islander children and youth in Australia still experience significant inequalities in health? With the information presented before, we can think in some factors. First, Indigenous people have had a long history of injustice, humiliation, and inequality. It is hard to think that because the government suddenly has the will to help them, they will embrace anything that comes from the part that hurt them the most. Also, some initiatives have been placed, but there are adaptations to existing initiatives made for non-Aboriginal Australians, and a lack of approach in a holistic way is part of the failure. When a component of community engagement or community development is integrated in the strategies, the results are better. Significant investment in Aboriginal and Torres Strait Islander health is required to rebalance decades of underinvestment, and the development of health policies specifically directed to this group are some actions that the government need to keep in mind. As a conclusion, Aboriginal and Torres Strait Islander people have great health needs. The reduction of stigma and the empowerment of this group could lead to a better health outcome. Regarding to the programs, it is important to include perceptions and notions of indigenous people. My references? Thank you.